Short video is going to be covering the wrist and fingers. So I wanted to just cover a couple slides here, and I wanted to start off with hopefully a review, something that you recall, starting with the wrist joint. So the wrist joint is a condyloid joint, which is an ovoid articular head is received into an elliptical cavity. So here we have a convex wrist joint, which is ovoid, being received into a concave radius, which is elliptical. So we have a condyloid joint. The movements at the wrist that are possible are flexion and extension, ulnar deviation and radial deviation, and then the wrist can circumduct inside of those planes. So in the frontal and the sagittal plane, the wrist can circumduct. So at the wrist, the joints that make up the wrist are going to be the radiocarpal joint, and then we're going to have a midcarpal joint and our our carpometacarpal joint. One more time, our carpometacarpal joint. So I'm going to move down into this. So the thing that I want you to glean from these two slides is that here at the wrist, we've got several joints that make up the entirety of the wrist. However, one thing that I want you to pull away is that the ulna will not participate in any of these joints. And I want to come to this slide here. So here again, we've got the radiocarpal joint for radius and carpals. We've got an intercarpal joint. And then down here, we'd have a carpometacarpal joint. Here on the ulnar side of the wrist, we actually have what's called a triangular fibrocartilage complex, or the TFCC. So it's essentially a cartilage. It's a cartilage complex like a disc that that is used to create and extend this joint out a little bit. But the ulna does not participate directly in the wrist joint. Then we're going to have our proximal row of carpal bones and our distal row of carpal bones. You might be thinking right now, well, where is the pisiform on this diagram? I'm going to come down here to this volar view of the wrist. So the pisiform, which is right here, it is part of the carpal bones. However, the pisiform only articulates with the triquetrum bone, and a couple of the things that I was reading about actually considers the pisiform more like a sesamoid bone. It's there to increase leverage and biomechanical advantage of some muscles, but because it only articulates with the triquetrum bone, its function in the wrist joint, like the gliding wrist joints, in flexion and extension and ulnar and radial deviation, is fairly minimal. So now I want to move down and just cover a few more things. This is a nice slide if you need a quick review of the bones that are going to be coming down through the wrist and hand. Color coordinated are 8 carpal bones, the metacarpals. We have 5 distal phalanx and 5 metacarpals, 5 proximal phalanx, and 4 middle phalanx because the thumb doesn't have one. And then moving down, a review slide here just of the articulations and movements of the wrist. So we're going to have the distal radial ulnar syndesmosis as the radius pivoting around the ulna, and if you pronate and supinate your wrist, you can try to visualize what's happening there. We have our intercarpals, which is a gliding synovial joint. We can glide our intercarpals in 2 dimensions, flexion and extension, and ulnar and radial deviation. So the 2 dimensions are the sagittal and the frontal plane. We have the carpometacarpal joint, which again is going to be a gliding joint in 2 dimensions. Our metacarpal phalangeal, which is a condyloid joint, because we can adduct and abduct our fingers as well as flex and extend. And then we will circumduct in those 2 planes. And then finally we have an interphalangeal joint, which is a hinge joint. We can flex and extend. A nice figure here just to help us visualize these. We've got the plane joints. Remember, between this first carpometacarpal joint, it's a saddle joint. The ellipsoidal joints are going to be here at the metacarpal phalangeal joints. Hinge joints out here at the fingers. And this This up here would be a condyloid joint. And then finally, if you need a review of the movements of the thumb and the planes in which they happen to move in, this slide here is a good resource. These two slides here are good resources if you need that review of the thumb. And that finishes this video of the wrist and fingers.